Hello, Dr. David McFadden again from the Dental Implant Center in Dallas, Texas. Thanks for joining the YouTube channel. We have a new concept. I came up with a way of explaining things to the patients just recently about the difference between all-on-4 and implant bridges. You've heard me for years now talk about implant bridges, the way we do them here versus the way they're done in tens of thousands of offices around the country. So the concept I came up with was over versus in. And what I mean by that is that the all-on-4 prosthesis actually fits over everything like this. So let's pretend that my knuckles are the implants. The prosthesis gets screwed in, but there's this skirt or flange or bumper of zirconia that's extended past the implants down your gums. And the reason that they do that is they're hedging their bets. They know there's going to be changes around the implants. Typically those changes are caused by the insult to the bone from the surgery where they remove many millimeters of bone. Then that starts the downward spiral or the snowball effect where the bone continues to remodel, the gums recede, and eventually you get exposure of the abutment or the implant or both. So as these implants get taller by the gums shrinking, with that skirt there, they're good. That's never going to be visible. The patient's never going to complain about the recession. But the problem is that concave surface made by the saddle or the over the gums design can't be cleaned, period. It cannot be cleaned, and I just released a video last week on that very topic. But I wasn't sure I did a great job explaining why. So everybody that's seen my videos know the difference between convex versus concave. Concave has been bad in dentistry since the first caveman had I guess cavemen don't get prostheses, but since the dawn of dentistry, we know that concavities are food traps. So we try to make everything convex. Well, a prosthesis designed like this is going to be a huge concavity, and it's going to collect food all the time. Versus what we do, our bridges actually go in the gums. We shape the gums with the temporaries. We continue to shape them with the permanents so that instead of this design around the implants, our implants actually fit down into the gums around the implants. So they're tight to the gums, they keep food from getting in, and they're really easy to clean. So I wanted to show you two cases of each example. So that I'm going to show you two that go over the all-on-4 type concept, and then two that go into the gums. So the first one here is a typical all-on-4 prosthesis where they removed 10 to 15 millimeters of bone. They put the implants in, and because they knew they were going to get continued shrinkage, they made this design that is not very conducive to cleansability, is the word we've invented. But when you take these prostheses out, you see nothing but food and plaque. We call that material alba in dentistry. It's a combination of food and plaque together. And it's nothing more than rotting or decaying food that you just simply can't get out with an all-on-4 prosthesis. And then that leads to gum irritation in the form of erythema and inflammation, which also continue that downward spiral of bone loss and gum recession. So this is what it looks like for that patient on the upper. This is what it looks like on the lower, even worse on the lower. And like I keep saying, they cannot be cleaned, period. The second case is similar, almost identical, where we show this saddle design, but it's more of a saddle. So the saddle can be adjusted. It depends on the lab technician that's making your case, but the shorter saddle is still uncleansable, but it doesn't tend to collect quite as much food. But the ones that are really large like this one, there's no way this patient has a chance to keep this clean. So that's her upper, that's her lower. This is what it looks like out of the mouth, and the same thing on the lower. So of course, everybody that cares about personal hygiene even a little is concerned about bad breath. This is absolutely causing bad breath in every patient that has it. And so we do get patients who come in complaining of that when they've had all in four done somewhere else. And spouses also come in complaining about that, as you can imagine. So what's the alternative? This is the alternative. This is the implant bridge that I've been preaching about for 5 years and doing for 30 years. So this prosthesis is convex. Every surface that touches the tissue is convex. So when you take it out, you've got beautifully shaped or beautifully sculpted soft tissues that are the recipient site or the framing of the teeth, and super easy to keep clean. That's case one. This is case two, another full arch upper jaw implant bridge where we shaped everything convex to fit down into the gums instead of going over the gums. And this is what her gum tissues look like this is probably after 2 months of shaping with the temporary, and then right before we put the permanent in. So I hope that explains maybe a little bit more simply the difference between a prosthesis that is easily cleaned, those that are convex and go into the gums, versus those that are impossible to clean, that are concave and sit over the gums. Thank you for listening.